So good afternoon, everybody. I really appreciate your time today to jump on the webinar for the 360 Plus program. My name is Elizabeth Roldan. You probably are familiar with me because I was the person hosting the webinars when you made your transition from the State Health Benefits Plan now to Horizon Direct. So we're here presenting the 360 Plus program, which is a new exciting offering to all Wallington Public School employees. 360 Plus is a preventative care management program that provides employees with relevant health information sent via text messaging. The program has no impact on your existing health plans that are offered by the district. This is completely standalone and separate. Employees will be enrolled in the program with a package of benefits that will have no impact to their net pay. That is probably the biggest takeaway for today is that the plans that you enroll in, and we've made some pre-elections for you if you've logged into the enrollment system, everyone has a budget of monies that they're going to be able to utilize to purchase additional health insurance products, and that is funded by payroll taxes. So it is not impacting your net pay. If any of you are in any other ancillary programs, such as, let's say, AFLAC, Prudential, Colonial, you know that those voluntary benefits actually do cost you something from your net pay. These plans through Allstate and through Delta are completely funded through tax savings, so there is no out-of-pocket cost from you. At minimum, all employees must complete one survey that's sent per year. It's sent via text message, and that's part of the compliance in order to receive those benefits. The survey is literally 2 questions. What kind of health information would you like to receive messaging about, and how would you like to receive that messaging, whether it's via email or via text? And you'll get weekly emails or texts, depending on which method you prefer, that will go ahead and talk to you about healthier lifestyles, a good low-calorie recipe, nutritional, things like that. So you'll be choosing what health topics you want to receive information about. But again, it's part of the compliance of being enrolled in the program that you do opt into those messages that come to you on a weekly basis. All the plans that are being offered are guaranteed issue due to Wallington's district size, and they're all guaranteed issue not only for the employee, but also for the spouse and or dependent children of that employee with no medical underwriting required. Usually, if you're shopping around for, let's say, a whole life insurance plan, which is one of the offerings that we have, you'll know that they go ahead and ask an extensive amount of medical questions and will require you in certain instances to get a physical and have biometric screenings done. But during this open enrollment and for the programs for the plans that are being offered, there is no requirement as everything is guaranteed issue. The rates are very competitive, so you'll see that you're going to be able to afford a lot with your budgets compared if you were buying these separately on the private sector. All the benefits are offered through Allstate and Delta for the employees that are in the program. And again, the benefits are offered at no net change to your paycheck for the participation in the 360 program. We're going to be going over in detail each of these 7 offerings, but they do include dental, vision, whole life insurance, accident insurance, hospital insurance, critical illness insurance, and an identity theft insurance plan. So let's jump right into the dental plans. You'll have 2 dental plan options, and you'll be choosing which one you would prefer. Dental plan 1, your preventative is covered at 100%. Your basic is anything from a filling to a simple extraction that's covered at 80%. And any major work that would include crowns and or dentures are covered at 15%. Plan 1 has a $1,500 calendar annual max. And Plan 2 is very similar in that the preventative, basic, and major are covered at the same percentages. 100 for preventative, basic is 80, and major is 50%. But Plan 2 offers a higher annual calendar max of $2,500, and it includes $2,000 for orthodontic work for children up to the age of 26. Another great feature about Plan 2 is that it offers dental implant coverage as well, and that falls under major. We usually see that people opt in more into dental plan 2, but again, completely your decision which plan you would prefer, plan 1 or plan 2. But plan 2 is a pretty terrific option because of the higher calendar max and the orthodontics. I can tell you that these plans are definitely more benefit rich than your current plan offerings through Horizon. You can actually keep both plans if you'd like. If you decided to keep your Horizon plan through the district and opt into either Plan 1 or Plan 2 of the Delta plan, you can keep both. Horizon would be primary, Delta would be secondary, or you can go ahead and completely terminate the Horizon plan to just have the Delta dental plan, and that would be primary. For those of you that have a spouse that you take your dental benefits through them, if you decided to opt into the Delta plan here through the district, Delta would be primary, your spouses would be secondary. But again, feel free to reach out to us and we can walk you through coordination of benefits, which is only specific to dental. But like I said, you don't have to make any changes to your Horizon plan. You can keep that and have Delta be your secondary. The next plan option would be the Vision plan, also offered through Delta. It utilizes the Delta VSP network. VSP is the nation's largest network of providers. So your big box stores like Walmart and Sam's Club are part of the network, as well as a bunch of other smaller independent optical locations. But the Vision plan offers a routine eye exam, as well as a $200 allowance for frames and a $200 allowance for contacts, both in the same calendar year. So you get both of those allowances every single year per person that is enrolled. Usually what we see with vision plans is in lieu of, so you either have to do the frames or you do your contact lenses. But in this case, with this Delta Vision plan, you get both in the same calendar year. And again, it would be applicable for each person that's enrolled in the plan. So now we begin with the Allstate plan offerings, the first one being the accident plan. The accident plan, if you have any children that are in sports or in types of active activities, or if you yourself, for example, if you're a phys ed teacher in the district, I would highly recommend the accident plan. What's great about it is that it covers any injuries that you sustain on or off the job, sports injury, a car accident, any external trauma to your body is considered an accident. And there is an entire schedule of paid injuries and what the payouts would be. So for example, under Plan 1, if you, and there's two plan options, Plan 1 and Plan 2, they both cover the same injuries, just that Plan 2 pays them out double. So for example, under Plan 1, if you had a slip and fall, you go to the emergency room, they decide to do x-rays, that's a $200 claim that you can file. I know that in another school district that we work in, the school nurse in that middle school, her son was at a jumping place. He he tore his Achilles heel, and she ended up getting paid about $2,800 for his entire injury under the accident plan. So again, something to really consider. I can tell you that from Allstate's standpoint, the accident plan is their #1 plan because people, whether they lead active lifestyles or if they have children that are very active or are involved in sports, it comes in very handy. What's also great about the accident plan is that even if you don't get injured during the year, it offers 2 wellness incentives that you can go ahead and file to get paid out $50 on each of them. So for example, if you get your annual physical and you perform another wellness activity such as a dental cleaning, a vision checkup, for a woman, maybe a mammography, you can get paid out $50 for up to 2 of those preventative services. So you don't necessarily have to get injured in order to make some money on the accident plan. The next plan offering is the whole life insurance. The whole life insurance is also a very popular option because it's whole life versus term. So if you know anything about life insurance, whole life is usually triple the price of term life. In Wallington's case, because of the group size, the rates are very competitive and are guaranteed issue with no medical underwriting or screenings or anything like that required. You as the employee can buy up to $150,000 worth of life insurance. Your spouse can get up to $75,000 of life insurance, of whole life insurance. And dependent children are eligible for it, although because they age out at the age of 26, they are only eligible for a $20,000 term policy. We usually don't see employees purchasing that for their dependent children. We usually see the focus being on the employee and or their spouse. But what's great also about the life insurance plan is that it has a conversion policy into long-term care. So if God forbid you were in a position of needing long-term care, which is something that's not covered by major medical or Medicare, you can use the face value of your whole life insurance policy and convert that for care in a long-term care facility. And the policy also builds cash value over time. So really, those two, the cash value and the conversion into the long-term care, make it also a very attractive offering. The next plan option would be the critical illness policy, which is very similar to Aflac's cancer policy, but the one through Allstate here is much more robust in that it's covering many more illnesses such as cancer, heart attack, stroke, major organ failure, paralysis, loss of vision, loss of hearing. You as the employee would be electing whether you'd like to select a 10, 20, or $30,000 payout, which would be paid out directly to you if God forbid you were diagnosed with one of the listed critical diseases. The critical illness policy program also offers a wellness incentive. So for one preventative wellness activity that is not a physical, so again, anything like a dental cleaning, mammography, vision checkup, even a preventative colonoscopy, for example, any preventative service like that, you can go ahead and file to get paid a $50 wellness incentive claim. The next policy is the hospital plan. Again, it has two plan options. You would choose between Plan 1 and Plan 2. Plan 1 offers a $500 payout on the first night that you're hospitalized, and then $150 per day after that. Under Plan 2, it pays out $800 on the first night that you're hospitalized, and then $100 per day up to 31 days. The hospitalization can be for anything from an illness to an injury. We also see it as a very popular option for an employee that is, let's say, currently pregnant. There is no pre-existing clauses or anything like that under the hospital plan. So if you know, for example, that sometime within the next 12 months you're going to be having a baby and you know that it's going to be in a hospital setting, we see this as a very popular option that members elect. Also, if you know that you're going into the hospital and you will be hospitalized for a major surgery, we had somebody I know a while back who had back surgery. They knew they were going to be hospitalized at least 48 hours. Another good reason to select the hospital plan. And then the last plan offering through Allstate is the Identity Theft Protection Plan, which offers up to $1 million worth of identity theft protection that includes $500,000 reimbursement of stolen funds, as well as for any legal fees that you may incur to recoup your identity. It also offers a monitoring service of your name and social security number on the dark web. So those are the 7 plan options that are being offered during this enrollment. Uh, we started enrollment about a week ago now, week and a half ago. All of you should have received an email from our enrollment system called Zevo. The email would have said system@zevobenefits.com. It may have landed in your junk mail or in your spam folder, so please double check it. But if you didn't receive it, reach out to us. We can certainly push another message out to you and also verify that the email address that we have that was provided by the district is the one that you would prefer to check your email in. Once you receive that email, you'll be able to log in and view all of the policies that are offered to you. As I said, we made some pre-elections to give everybody a little bit of everything, again, keeping them within their budget so their net pay is not impacted. But you can totally go ahead and make any changes that you would like or add any dependent children or spouses that you would like to those policies. If you are going to be adding on any dependents, feel free to reach out to us directly so we can go ahead and do that for you. You can also schedule a virtual appointment to add those dependents or just discuss your enrollment further. You can go to the website, which is wallington360plus.com/enrollment. So you can reach us via the website. You can call our office at the 800 number listed here. You can also send us an email. I've received quite a few emails from Wallington employees just asking more questions about what the coverage looks like for the hospital plan and also for dental. I know those have been popular questions I've been seeing. So feel free to send us an email with any of those questions. Your welcome email looks something like this. It'll let you know how many days you have left of open enrollment, and it'll provide a link that you'd be clicking on. Once you click on that link, you would click on register since you haven't accessed the site previously. It's going to ask you to enter in, because again, there's personal health information here, it's going to ask you to enter in the last 4 digits of your social, your date of birth, your name, your email address, and a password of your liking. And once you actually register, you'll be brought to the benefits portal and you can go ahead and click on enrollment. It'll ask you to confirm that your information is correct. So your mobile number, your email address, and your home address, that they're all correct, and your date of birth, of course. And then you'll be brought to the benefit screen where you can actually scroll through all the 7 different plan offerings, and you'll see some pre-selected for you, but you are more than welcome to make any of those changes on your own. And once you actually finalize your enrollment, you're satisfied with your elections, you can click on confirm your selections and then confirm and finalize. For those of you, and then once you confirm and finalize, you'll get an instant confirmation of your enrollment. It'll show you, it'll be a PDF attached to an email, and it'll show you what coverages you're enrolled in. And something that I did want to mention is that you don't necessarily have to enroll your entire family in every single coverage. So for example, let's say only you and your spouse use glasses, but you want the dental plan for the whole family, you can choose very a la carte and do family dental coverage and 2 adult vision coverage. So you can be very a la carte with how you choose your enrollment. For those of you that are looking to waive your coverages, you would go through the same steps, but instead of making a plan election, you would just click waive and make sure that you're waiving all of the coverages that are offered, and then you would click on confirm. And again, you'll get a confirmation email letting you know that you've waived all of those coverages. So with regards to next steps, I highly encourage everyone to log on and review the elections in the enrollment system. Again, if you'd like to add on your spouse and or dependent children, please call, email, or make an appointment with us so we can connect you with one of our enrollment team members. Another big takeaway for today is the deadline to make any changes is Friday, April 11th. That is the absolute last day for open enrollment. And again, if you don't want the package of benefits that are funded through tax savings and you want to opt out, you would just need to go ahead and click waive under those coverages. But if you'd like to keep your elections as we loaded them in the system, nothing really else is required and your enrollment will be processed. All of the benefits will be live on May 1st. For dental, you'll be receiving ID cards. Everything else is managed through the Allstate member portal. As far as filing a claim. So that's all handled digitally. And for the vision plan, you'll just need to provide that provider your social security number because that's how Delta tracks you in the system. With that said, I'll leave our information here on the screen. Are there any questions that I can answer or anything else that you'd like to know about?
Yes, Elizabeth.
Yes.
So if we add our spouse or dependents to any of these policies, do we then have to pay a premium, or is that within our allotted budget?
No, we'll work with you to make sure we keep you under your budget. So for example, let's say your budget is $100 per pay, and you're going to go ahead and say, Liz, I want the dental plan to be the first option. Let's see what's left over, and I'll maybe put the rest into the accident plan. So you as the member would be dictating what coverages you prefer, who you want to enroll in what. And that's a very good point because going back to, you know, the a la carte in that sense that you have a budget of monies, you want to utilize it towards the coverages that you'd like. So that's why no need to enroll the entire family in vision coverage if only, you know, you and your spouse, or maybe you and the children are the only ones that need it. So you can keep the rest of your budget and push it towards the next plan. So you as the member are telling us what plans you'd like to enroll in.
Okay. So that's why we have to contact you once we decide to enroll spouse
Correct.
or dependent. Okay.
Correct. Because we want to make sure that we keep you within your budget. I can tell you, we just finished a very large municipality that actually borders with Wallington. And I want to say about maybe 15 employees out of a few hundred employees that they have went over their budget. They just really wanted to max out and get the full on the life insurance or, you know, get everything for their family. I can tell you at another district that I was working with in Essex County, we had an employee that she was going through her own life insurance purchase, and she had been recently diagnosed with AFib, and her premiums had skyrocketed because of this new diagnosis. It was cheaper for her to go over her budget with us to get the full $150,000 on the life insurance than it was for her to get it on her own with that carrier directly. So you don't have to go over your budget, but it's completely up to you. Anything over your budget then does become a deduction, but if you stay under your budget, your net pay stays the same. Perfect. Any other questions, anybody? I also just want to remind everybody, we are going to be on site next week. So we're going to be at the business office on Monday. We're going to be at Jefferson School on Tuesday, Galax School on Wednesday, and we'll be at the high school on Thursday. I assume we'll be in the teachers' lounges. I'm not sure where they will accommodate us when we're in the building, but we are going to be there specifically during your lunch periods, so you can connect with any one of our enrollment team members. Jen, go ahead. I see you have a question.
Can you hear me?
Yes.
Okay. I understand that everybody gets allotted money, but I'm not understanding how this doesn't come out of our paycheck. Like, how is this paid for?
The way that it works is the IRS and the ACA are incentivizing employees to go ahead and utilize a portion of their federal FICA and Medicare taxes, which are the taxes that you contribute off of every payroll. So we're using a portion of that to purchase these products. So that is how the insurance is funded, where it's not costing you anything from your net pay because it's being funded through those three tax savings. One of the questions that we get a lot is, well, what if I don't enroll? What happens to that money? It stays at the federal government. It's kind of a use it or lose it. They don't allow it for it to come back into your paycheck as passive income because the goal is to incentivize employees to be overinsured so there's less dependency on federal programs such as Medicare.
Will we need to claim this when we file our taxes?
No, because it'll be reflected in your W-2. Your W-2 will reflect that you've contributed this towards the purchase of health insurance products. It functions kind of like a Section 125 plan. So when you do your taxes, and I'm sure a lot of you are probably either done or just about to be done with your taxes this year, you'll see that you're contributing towards your medical premiums, for example. That also falls under that pre-tax Section 125, and this is how this program functions.
So it won't put us into different tax brackets or anything like that?
Not at all.
Okay.
But a very common question that we get a lot. So good question.
Liz, I had a quick question. The critical
Yes.
illness plan,
Yes.
you mentioned cancer, et cetera, et cetera. Pre-existing, can you have pre-existing for that?
Yes and no. So if you are someone that was diagnosed with cancer, let's say 3 years ago, and you are technically officially in remission now, and God forbid you get diagnosed again after this plan is active, that's not a problem. But if you have an active diagnosis when the plan goes in, you can't file a claim for that because you were already diagnosed and you're currently in that illness.
Gotcha. Makes
Yeah.
sense. All right.
Yeah.
No, thank you.
No worries. Any other questions? Jen, I'm not sure if your hand is up from last time or if you had another question, but feel free to unmute yourself.
No, I'm done. Thank you.
Okay, good. All right, everybody. Well, if you think of anything, like I said, we'll be in person all week next week. You can certainly reach out to us by calling our office or sending us an email. We're in Belleville, so we're very close to Wallington. But I am sure that I will see a lot of you next week. I'll be one of the people on site. And I thank you for your time today. And please let us know if you need anything. Have a great rest of your evening.